Hello, my name is Tashina Buffalohead, and I am a Community Health Facilitator of the Facts Not Fear ICT project. Thank you for tuning in to this community health session. We will be discussing stress and mental health today. This community health session presentation is for information purposes only and is not intended as promotion or medical advice. Always seek advice from your healthcare provider regarding any questions you may have about medical concerns, condition, diagnosis, and treatment. So, mental health. What does mental health mean to you? So in the past, participants would say, I would keep my body moving and keep healthy, drinking more water, going for more walks, keeping contact with family and friends. Those are some examples. What are you currently doing to keep your body and mind healthy? And who or what are sources of information do you look to when you try to improve your health? Participants would say Google, or they would say look to my doctor for sources of information. Tips to improve your health: eating healthy, exercising regularly, maintaining a sleep routine, staying hydrated, quit smoking, and getting regular checkups. And important, de-stressing. What is mental health? So mental health includes our emotional, our psychological, and social well-beings. It also affects how we think and how we feel, and also how we act. Mental health is important at every stage of our lives, from our childhood to our adolescence and through our adulthood. Over the course of your life, if you experience mental health problems, it is your thinking, your mood, and your behavior could be affected. So today we'll be focusing on stress and anxiety. Stress versus anxiety. So stress. What exactly is the cause of stress? It is a short-term and in response to a recognized threat. Stress is a reaction to everyday pressures, but it can become unhealthy when it upsets your day-to-day functioning and activities. Stress is perhaps normal human reaction, and it happens to everyone. It is everywhere in our lives. Anxiety. What exactly is anxiety? Anxiety can linger and may not have an identifiable trigger. Anxiety is an emotional characterized by feelings of tension, worried feelings, thoughts, and physical changes like increased blood pressure. And people with anxiety disorders usually have intrusive thoughts or concerns. They may avoid certain situations out of worry. They may stay at home. They may have sweating, trembling, dizziness, rapid heartbeats. But anxiety is considered a future-oriented, long-acting response. But this can be treated, and it can be treated through your doctor. So now, let's go on to what are some things that could cause stress? Debt, bills, divorce. Media can be a stressor. Facebook, Instagram. The thoughts of worrying about what is on the media. But it can be a useful tool as well. Media can be useful by connecting with friends, by reconnecting with family, but it can be a stressor. So we have to give media a break. Symptoms of stress. So both stress can affect your mind and your body, and you may experience symptoms such as excessive worry, the loss of sleep, the uneasiness, the tension, the body aches, high blood pressure, hair loss, headaches, and there's many other symptoms that come along with stress. So now we will talk about positive coping strategies so you can improve your health. So some strategies to cope with stress are focus on what you can control. And try not to focus on what you can't control. Put your stress in perspective. Do what you can and not what you can't. So celebrate your small wins. Break down your goals and not make them so big. Make them small. So do what you can. Let's look at some other additional coping strategies. So maintaining a positive attitude. So the way you think about things really does affect the way you feel. So if you tell yourself something is going to be hard, well, it's going to be hard. So going into a situation of saying, oh goodness, this is going to be a difficult day and I just don't think I'm going to be able to do this. Well, guess what? It's probably going to be hard. But if you go into somewhere where you're going to have a positive attitude and say, this is going to be easy, I'm going to be able to do this, well, then it's probably going to be an easy thing to do because you're going to walk in and you're going to have that positive attitude. So maintaining a positive attitude is going to be a great thing to do. Learn what triggers your anxiety. So make a list. Like if you know what triggers your anxiety, make a list of things that you recognize that triggers that. And journaling. Journaling has revealed your inner thoughts and put things in perspective. And some more additional coping strategies. Positive self-talk again. Words of affirmation. So words matter to every individual in life. A few tips. Repetition. So using Post-it notes, and I'll go more into this in the next slide, is using good words for yourself and good words for others. And research has found that having good positive thinking and thoughts for yourself has actually lowered rates of depression, has lowered levels of distress and pain, and also reduced risk of death from cardiovascular disease and stroke. So these are good coping skills as well. So let's go into a little activity. So there at home, if you can, grab a piece of paper, a Post-it note, anything, and write down the words I am, or I can, or I will in the sentence, and follow that by something to make yourself better, like I am beautiful, or I will be able to do this today, or anything to make you feel better about yourself. And that'll help you during the day to make it better, make a positive day. Additional strategies for you is taking deep breaths. If you're having a bad day, or if things are too hard, sometimes you can just take deep breaths. Turn around, take a deep breath, slowly count to 10. Do that maybe 3 to 5 times. Take a deep breath in, take a deep breath out, slowly count to 1 through 10, and repeat as necessary just to kind of revitalize yourself. Another strategy is giving back to your community and feeling good about helping other people. So volunteer or find another way to be active in your community. Giving a break from everyday stress and taking that time to relax and recharge. Take time for yourself and go back to your hobbies and do what makes you happy. And again, take a media break. And maybe I'm not telling you to totally put away your phone and get away from, Facebook or Twitter, but just put that away. Maybe take 10 minutes than normal or 30 minutes than normal from your phone usage, and just break it down, So take away that media break and give yourself some time. And some other ways to manage stress are limit alcohol and caffeine. It is known that anxiety can be triggered by alcohol and caffeine usage. So drink more water, And also eat well-balanced meals and get enough sleep. And also exercise daily. And which of all of these coping strategies may be easiest for you to try, looking back of what we were just discussing earlier? So looking at depression. So ongoing stress can lead to depression. Everyone experiences sadness at times, but depression is something more. Depression is experiencing sadness. It can last more than days. Depression is the most common mental disorder. Fortunately, depression is treatable with a combination of therapy and antidepressant medication. So what are the symptoms of depression? Some symptoms of depression are low mood, loss of interest in activities, the feelings of worthless or guilt, withdrawn from social activities, significant weight loss or weight gain, the difficulty of making decisions, insomnia, reoccurring thoughts of death or suicide or attempted suicide. And if you know someone going through a difficult time and notice these symptoms, it is okay to ask if they are having suicidal thoughts or are attempting to commit suicide. They more than likely want you to notice and have you check up on them. And if you're struggling to cope or the symptoms of your stress or anxiety interfere with your everyday life, talk with a professional, talk with your doctor, or talk to people you trust about your concerns and how you're feeling. Share your feelings and with a friend, a parent, a counselor, your doctor, or even a pastor. And right now we're going to share some resources. Right here is a Calm Care 24-hour hotline. Also, this is a 988. Anyone in Sedgwick County and across the county who is experiencing mental health-related distress or worrying for a loved one's mental health will be able to dial or text 988 to receive support from the National Suicide Prevention Lifeline 24 hours a day, 7 days a week. And in every one of our sessions, we do a moving towards action. So just think about it. In the next 30 days, what is one thing you will try to help you cope with stress? So I want to thank you for your time today, and visit factsnotfearict.com or scan our QR code for more community health session videos.